Figuring out fertility can feel, well, super complicated, especially when ovulation isn't quite going to plan. But what if we could just map it all out? A clear, understandable path from identifying the issue all the way to exploring a solution like IVF. So let's do just that. Let's dive in and walk through this journey together. And it's so true. I mean, think about it. Every single month, your body pulls off this series of incredibly precise events, all aimed at the potential for new life. It's this whole intricate dance that's so easy to just take for granted, right? At least until you start really paying attention. So, the star of that monthly show? It's ovulation. That's the main event, the moment a mature egg is released, ready to go. Without this one step, conception just can't happen. It's really the starting pistol for the whole race.
Okay, this is where it gets really cool. This shows us that ovulation isn't just one thing happening. It's this whole performance, a perfectly synchronized hormonal orchestra. So first up, you've got FSH. Think of it as the conductor, telling the follicles, hey, time to grow. As they get bigger, they release estradiol, which gets the uterus ready. Then comes the drum roll, the big LH surge, which is the signal for the egg to make its grand exit. And finally, progesterone steps in to keep the stage set for a potential pregnancy. It's just a perfect symphony.
But, what happens when one of the instruments in that orchestra is a little out of tune? Or maybe a lot? Well, that's exactly when we get into ovulation disorders. It's when that beautiful rhythm gets thrown off. So what could actually mess with this super delicate biological machine? It seems so perfect, right? Well, it turns out quite a few things can. The body's hormonal balance is incredibly powerful, but it's also really sensitive to all sorts of things happening both inside and out. And here we go. This slide lays out some of the usual suspects. You've got PCOS, which is a big one, all the way to hypothalamic dysfunction, which, wow, just goes to show how much things like stress or big weight changes can totally affect our reproductive health. Even stuff with the thyroid or pituitary gland, which you might not think are connected, they play a huge role in keeping that hormonal orchestra in sync. Okay, let's zoom in on PCOS for a sec, because it's such a huge piece of the puzzle. This chart is great. It really breaks it down for us. The classic signs are these hormonal imbalances, high androgens, which some people call male hormones, a good bit of insulin resistance, and this wacky ratio of LH to FSH. That whole imbalance is what stops follicles from maturing the way they should, and that leads to those irregular cycles. Okay, this is super important because there's a really common mix-up here. Just because an ultrasound shows you have polycystic ovaries, lots of follicles, that does not automatically mean you have PCOS. Polycystic ovaries are just a finding. PCOS is the whole syndrome, the hormonal disorder that comes with a bunch of other symptoms. It's a really, really important difference. Okay, now for a statistic that I think is just so incredibly hopeful. For women who get a diagnosis of premature ovarian insufficiency or POI, it can sound really definitive, but check this out. Studies show that somewhere between 5 and 10% of women with POI might still ovulate every now and then, and some even get pregnant. It's just such a powerful reminder that our bodies can still surprise us. It's not always a closed book. All right, so we figured out the rhythms off. But the good news, the really good news, is that there are clear, established first steps we can take to try and get that hormonal harmony back. So the treatment path usually kicks off with things we can actually control. And don't underestimate these. Simple things like diet, exercise, and managing stress can be so powerful. Sometimes that's all it takes to get things back on track. If that's not quite enough, the next step is usually bringing in some oral medications to give ovulation a little nudge. Now, when it comes to medications, the two big names you'll hear about are clomiphene, you might know it as Clomid, and letrozole, or Femara. Clomid basically tricks your into into thinking estrogen is low, which kicks FSH and LH production into high gear. Letrozole gets to the same results, but in a different way. It actually lowers estrogen to boost FSH. For a lot of women with PCOS, letrozole has kind of become the preferred choice because it can be more effective and often has fewer side effects. Okay, so let's say you've tried those first steps. You've made lifestyle changes. You've done a few rounds of oral meds, but you're still not getting the result you're hoping for. This is the point where the conversation naturally shifts and we start looking at a totally new pathway, IVF. And that's the big question, right? What now? It can feel really discouraging when those first treatments don't work. But listen, it is not the end of the road. Not even close. It's just a sign that maybe a more direct, more powerful approach is what's needed. So when does a specialist usually say, okay, let's talk about IVF? Well, it's often after about 3 to 6 cycles of ovulation induction haven't been successful. It also becomes the go-to option if there are other things going on, like blocked fallopian tubes, or if age is a factor and time is really of the essence. I absolutely love this quote because it completely changes how we think about this. IVF is not a last resort. It's not a sign that you failed. It's a proactive, strategic, and honestly, an incredibly effective move to take control when you need a more targeted approach to reach your goal. And one of the most amazing things about IVF is that it's not some cookie-cutter treatment. Your plan is completely customized to you. It's designed to tackle the very issues that were causing ovulation challenges in the first place. So this table does a great job of comparing the two most common IVF game plans. The antagonist protocol, that's the shorter one, is often the top choice for women with PCOS. And that's a big deal because it really lowers the risk of something called ovarian hyperstimulation syndrome, or OHSS. The agonist protocol takes longer, but it offers a different kind of control by quieting your natural hormones before you start. The choice really comes down to your unique situation. And this right here, this visualizes the whole game-changing shift with IVF. See, in a natural cycle, your body's aiming for one perfect egg. With conventional IVF, we're changing the goal. We're using stimulation to safely mature a whole group of eggs, usually somewhere between 8 and 15. And why do we do that? It's simple, really. More eggs give you more shots on goal, more chances to create healthy embryos, which just skyrockets the chances of success from that one cycle. Okay, so let's wrap this up. What are the big things to remember? First, ovulation really is like a complex hormonal symphony. Second, lots of things can throw that rhythm off. But the most important thing is that there's a clear treatment path, and IVF is a powerful, personalized tool on that path. It's not a last resort, it's a really effective strategy. Now, it's so important to remember that everything we've talked about here is for educational purposes. It's absolutely not a substitute for personal medical advice, so please always talk to your doctor. And if you're looking for more info on the whole in vitro fertilization process, a really fantastic resource you can check out is the portal ivfforme.com. And that kind of leaves us with a really exciting thought, doesn't it? We've seen how personalized IVF is today, but science is moving so incredibly fast. So what does the future of truly personalized care look like? How much more precise can this journey get? It's pretty amazing to think about.